Psychopathology 2. Treatments. Behavioral therapy, psychotherapy, talk therapies. Divided in psychoanalysis and cognitive behavioral therapy. Psychopharmacology, treatment with drugs. Psychotherapy is a social interaction between a trained professional and normal person, and tries to help him to behave and feel differently. Psychiatrists go to medical school, and can give prescriptions for drugs. Psychoanalysis. Freud. He said that each person has conflicts, feelings, tensions, desires, thought, and patterns, all within us. Free association. Resistance. Transference. Interpretation. The ideas he has are at the edge of the field, because it's not an evidence-based science. But still are useful and people apply their ideas in many ways. Cognitive behavioral therapy. Beck. It's about behavior, and the interaction between a clinician and a person. Dysfunctional beliefs, like depression and anxiety. Logical thinking errors. Not focus in childhood causes, but on current problems to face day-to-day and how to overcome them. Time limited, around 8 weeks. Meta-analysis. Statistically, if you combine many different studies, you have an overall picture. Looking for the effect size, about the consistent size of psychotherapy treatment, and asking what happens. Image 9 o'clock. An average effect size of 0.7 treated, it's a useful treatment. Where the average person receiving psychotherapy was better 80%. Only 10% got worse. But what matter is talking to somebody who listens to you on a consistent basis. Psychopharmacology. It's really hard to develop medications for psychiatric diseases. Most were discovered by accident, were developed for something else. And many companies are abandoning the research, because they're not making any progress. Obsessive compulsive disorder, OCD. Anxiety disorder. Obsessions, recurrent and unwanted thoughts. Compulsions, repetitive behaviors. Like hand washing, continuing, cleaning, etc., done with high intensity so the person can't do other things. Behavioral treatment plus clomipramine is the best treatment. If you only medicate them, they relapse, 40%. Both treatments, talk and drugs, have hyperactivation in the basal ganglia, and in the caudate. Which means both works kind of in the same areas, and both are effective to help people. Depression. Fearful, helpless, hopeless, withdrawal, etc. 4 to 12 months if untreated. Pervasive dysphoria, anhedonia, inability to feel pleasure, mental pain, loss of interest. 5% of world's population. Onset in 30s, after 60 rarely you have depression. Women have depression at 2 or 3 times the rate of men. 70% who have an episode will have another. Symptoms. Disturbed sleep. Diminished appetite. Loss of energy. Decreased sex desire. Slow thoughts/actions. Poor concentration. Worthlessness. Guilt. Fixation on death or suicide. There's a genetic predisposition. 50% monozygotic twin. 10% dizygotic or siblings. But most important are environmental factors. Nowadays people get depression earlier in their lives. People with depression have a bias to respond quicker to sad faces than happy faces. Also, young girls who have a low likelihood of having depression, no family history, they tend to dwell on the happy faces. And girls who born in a family with depression, they dwell on sad faces. But it's because of environment, they might see one of their parents depressed, or maybe genes. Most possible both. Brain basis of depression. Less activation in the subgenual anterior cingulate, sits over the corpus callosum. And the volume is reduced. They have an equal number of neurons but a reduced number of glia, neurons that compute the mind, glia brain function. It occurs changes in the anterior cingulate with treatment, and the differences predicts which patients would benefit more or less for treatment. But the anterior cingulate it's not the whole story. $10 billion in sales of medications for depression, 2010. About 50% patients don't achieve remission after medications or behavioral treatment. And there's no scientific basis for knowing what drug you should get, depends on the physician. The people who recover better are the ones who get CBT over longer periods. Patients with severe depression, with ideas of suicide, you must give them drugs, because they can't wait 8 or 16 weeks to let a CBT process happen. Hamilton scale, to know how depressed are you. Placebos have strong response. Depression is a fluctuating disorder, so if a person at the beginning feels really depressed, the next week he will feel a little bit better, he remission to the mean. So, we don't know if it's because of this, or the placebos really help people. Getting help is a really good thing, even if it's a placebo, it will help people with depression overcome that. Adhd occurs in childhood. Inattention. Hyperactivity, 80%. Impulsivity. Diagnosis by exclusion, make sure there's no other problem in the child's life, like abusive home. Diagnosis. History from parents and physical exam. Collection of data from school and parents using questionnaires. 3 to 5% school-age children. Impairs social and academic adjustment. Predicts antisocial behavior, substance abuse. Treatment, methylphenidate, Ritalin. It has a genetic predisposition. 7 times higher rate within families. 0.76 heritability in twins. Genes related to the dopaminergic systems of the brain, not yet sure. Diagnostic criteria. Inattention, for at least 6 months. Careless mistakes. Difficulty sustaining attention. Not listen. Not follow instruction. Not finish tasks. Easily distracted. But how many 5-year-old don't fill these criteria? That's why it's so hard to do a proper diagnose about this. Hyperactivity. Leaves seat. Difficulty playing quietly. Talks excessively. Runs and climb excessively. Impulsivity. Blurts out answers. Difficulty awaiting turn. Interrupts others' conversations. Symptoms present before 7. If untreated. Depression. Anxiety. Substance abuse. Academic failure. Work and family problems. 2-3:1 boy, girl. MTA study. The best way to treat ADHD is medication plus support. If they show gains on anxiety, academic performance, relations, social skills, you lower doses of medications. But 8 years later, no difference. 61 to 5% stopped taking medication. No difference between those who did or did not stop taking medications. But maybe it was because the kids who stopped taking medications were the ones who improved at faster rates with the help of other facts. There's no behavioral test to say that a kid has ADHD. What's the right dose? When you go to a doctor, they titrated the dose, they push it up or down depending on the improvements or deficits of the patient. Because most of the time they give a higher dose, because what counts as better for the teacher or parents is if the kid is completely sedated. But this is bad, because their performance at different tasks goes way too low. So, this isn't helping the kids. Brain imaging. The idea that the cerebral cortex has too many neurons and connections, and as you grow, you eliminate neurons and synapses that are not functionally valuable. For kids with ADHD, their development in the prefrontal cortex is delayed for 2 years compared to normal kids. But there's no difference in the somatosensory cortex. Sensory stimulation, okay. Regulate control, terrible. Nucleus accumbens equals anticipation of reward. Medial prefrontal cortex equals you get the reward. In patients with ADHD, their nucleus accumbens doesn't activate when they're waiting for a reward. But their medial prefrontal cortex gets more activation than normal. Which means, because they can't feel the sensation of anticipation or reward, they don't do the things. If you give them Ritalin, it doesn't slow down the development of the cerebral cortex. Ritalin is one of the least problematic medications in psychiatry, very low side effects. Also, if you give Ritalin to kids without ADHD, their performance in cognitively demanding tasks increases. Ritalin binds strongly to the basal ganglia, involved in habits and impulse controls, part of the dopaminergic pathway. What's the boundary between treating an outright disease and manipulating normal variation? People with short stature should get growth hormone or not? What's the boundary between sadness and depression? Shyness vs social anxiety disorder? Don't follow directions vs ADHD? Should you be helping those in despair, or boosting those in the middle? Example of the book. Natasha K. At 88 she felt thrilled, extremely well, shy to flirtatious, telling jokes. Turns out she has syphilis, Cupid's disease. She's disinhibited and having a good time. So, you should give her medication? At the end they give her penicillin, it protects her medically. And luckily for her, because the brain changed from the neurosyphilis, she remains happy all the time.